Hello, this is Dr. Gay from First Lake MRI, and this is a patient who has lateral foot pain, and the podiatrist was worried that they had a tear of one of their lateral tendons over here. So he said, please exclude a peroneus brevis tear, and the peroneus brevis is this little dark band here. And we can see the peroneus brevis tendon at the ankle, and it comes down, down, down here, and it attaches right here. This is the base of the fifth metatarsal, so we can say the patient definitely does not have a tear of the peroneus brevis like they're worried about, but they do have a peroneus longus tendon here behind it. It looks normal up high, but as we go down lower, right here, right deep to that peroneus brevis, this is the peroneus longus tendon. As it starts to go obliquely underneath the foot, there's a bright spot. The tendon should be really dark, but instead we have an ovoid region of intermediate signal or low signal, and this is an accessory ossification called the os peroneum, little accessory ossification, and it should be light bulb bright like this, or like this fat here, or fatty marrow, but instead it's dark, which means it's abnormal. And right here is the same thing. This should be dark, but instead it's bright. All the bones are dark here. So this is a stress fracture or stress reaction, microtrauma of this os peroneum, and this is called painful os peroneum syndrome, or POPS, P-O-P-S, and this was related to overuse often, or sometimes a prior injury, and you get micro trauma or stress injury of that, and it'll become really bright like this and cause localized pain in the lateral foot. And the treatment is typically just conservative therapy, and luckily this is not a tear of the tendon that would require surgery. It's just painful os peroneum syndrome. We can see this on some other views, like this view. We see the peroneus longus tendon coming down. There's the brevis in front, and right there, that white line is the painful os peroneum, the partially torn or stress injury of that tendon. We have another view here called a coronal view, where we can look at this and see the same thing, and this probably shows it best. This is the os peroneum. There's a tendon next to it. It's right within the tendon there, and this is that light bulb bright meroedema, so severe meroedema called painful os peroneum syndrome. Thank you very much.